everyone being here. My name is Julie Mayfield. I am the state senator for Senate District 49, which is Asheville and Buncombe County. And I am speaking today both in that role and as a leader of Reclaim Healthcare WNC. And I'd like to start by acknowledging the many state and local elected officials behind us. Their presence here underscores just how much Mission and HCA continue to be of concern to the leaders in our community. So we're here today to talk about some recent and alarming events at the hospital that have come to our attention. We are also going to talk about staffing. That is a refrain that you have heard from us many, many times. I want to acknowledge up front that HCA has committed to a very aggressive staffing program, hiring 200 staff, including 100 nurses in 100 days. We hope they meet that challenge, but as we'll discuss later, setting and meeting that goal is necessary but insufficient. So to set the stage, I'd like to share with you the voices of some Mission patients, family members, and staff that we have heard from just in the last 2 months. Their voices are critically important to any discussion about Mission and HCA. And I will again say at this point, at the outset, that we strongly support the nurses and the staff who work in the hospital every day and to continue to provide the best care that they can. But they are working within a system that under-resources them on multiple fronts. So these are some voices from patients and family members. Quote, "My husband was clearly in pain and due for more meds, but it took an hour and a half for the nurse to get to us. I was wandering the halls along with the wife of another patient looking for the nurse. When we found her, she looked completely overwhelmed and said she was doing her best to get to everyone. People should be able to trust that their loved ones are in safe hands at Mission, and I definitely don't feel that way. In the future, we will do everything we can to avoid Mission, but we are angry and heartbroken that our previously world-class hospital is being so poorly run by a company that cares more about profits than patient care or their staff." Quote, "My recent stay at Mission Hospital revealed serious breakdowns in communication, coordination, and patient care, issues that demand immediate attention. This isn't just my story. Many others have reported similar concerns. Asheville deserves a hospital system that meets the needs of its people. At present, Mission Hospital is not meeting that standard. To be clear, this is not about individual nurses or doctors. Most were kind, attentive, and doing their best under difficult conditions. The problems I experienced are systemic. Failures in process, communication, oversight, and resource management. I needed care and found a system that struggled to provide it." Quote, "Mission failed me and they failed my child. She deserved to come into this world in a better way, and I deserve to be listened to and treated like a human being. I hope Mission gets shut down or sold to a better company that will make the right kind of changes." This next set of statements are from staff and nurses inside the hospital. "I can't count how many times today I called out for help over the radio and no one even responded. No one came to help. I was so angry I cried. It's disgusting that someone has to code before I can get help or even a radio response. HCA staffing decisions today were the most dangerous thing I have ever seen." Quote, "The core issue is staffing. Many rooms remain closed due to insufficient staff, which limits patient throughput. When rooms are open, nurses are often assigned 4 patients at once. Staff across departments consistently express the same concern. This is not safe and is unsustainable. In high volume situations, some nurses are assigned up to 6 patients, well above the standard 1-to-4 nurse to patient ratio." Quote, "Despite staff voicing concerns, leadership's response has been largely reactive. While new hires and travel nurses are being added, onboarding takes time and many travelers leave abruptly due to safety concerns. Communication from leadership rarely addresses bedside staff's core issue, safe patient care. Instead, updates often focus on metrics like patient satisfaction scores, which feel disconnected from frontline realities. And finally, quote, "We need help like now. This weekend makes the second or third death in a 6-week time span." We hear many stories from patients and providers. Some are positive, with good care and good outcomes. Others are mixed. But recently, we are hearing about cases where outcomes are tragic, and that is what we need to talk about today. Over the past 2 months, multiple sources inside the hospital have reported deaths that they believe were preventable, tied to breakdowns in Mission's telemonitoring systems. At least one of these cases involved short staffing directly, and staffing pressures may also contribute to the broader pattern. I have submitted these cases to state and federal regulators, and I have spoken personally with DHHS Secretary Dev Sangvi and implored him to return investigators to Mission immediately. Telemonitoring is supposed to be a safety net. Patients wear monitors that track things like oxygen levels and heart rhythms, and remote technicians watch the data for dozens of patients at once. When they see signs of distress, they escalate to the bedside team, and if needed, call a code blue to bring the hospital's code team to the room. It is designed to save lives. But when nurses are too stretched to respond quickly, technicians feel pressure to escalate sooner. That has led to more code blue calls overhead, some of which are immediately canceled, creating alarm fatigue and raising the risk of slower responses when a real crisis does happen. We've even been told of cases where the code team was directed to the wrong room, wasting critical minutes when seconds matter. Each one of these instances is alarming on its own. Together, they point to a system under severe stress. And the common thread is clear. Without enough staff at the bedside, even basic safety nets like telemonitoring start to break down, and patients pay the price. So why go into so much detail about this? Here's why. We know that DHHS came to Mission Hospital in May to investigate 35 cases, many of which were submitted by Reclaim Healthcare WNC. And in July, we heard from DHHS and Mission that no deficiencies were found, making it seem like Mission got a clean bill of health. But subsequent communication from CMS and DHHS revealed that not only were some of the claims in fact substantiated, but that one of them resulted in a violation of the federal law called EMTALA. This violation related to the February death in the emergency department bathroom. So apparently, HCA can commit a violation of federal law, and the regulators can find that there were other deficiencies, but the public might not ever know. CMS and DHHS take the position that if HCA has corrected the deficiency prior to them arriving, that they will not cite Mission for a deficiency, even when the deficiencies existed at the time of the complaint. So if, for example, Mission addresses and fixes all of these problems with the telemonitoring system, which, to be clear, we want them to do, but if they do that prior to regulators coming to inspect the hospital, we might not ever hear about the problems that exist today. So, it is incumbent upon us to share these problems, not just with the regulators, but also with the public when warranted. I will now turn this over to the Reverend Dr. April Love Fordham, who will talk about her experience in the hospital earlier this year.
Good morning or good afternoon. I'm Reverend Dr. April Love Fordham, as introduced. I'm 63 years old, a North Carolinian with mountain roots that go back generations in the Western North Carolina area. I hold 2 degrees from Georgia Tech, spent my career managing software companies, then answered a call to pastoral ministry. I'm not a stranger to hospitals, having done my chaplaincy internship at Children's in Atlanta and the VA hospital in Atlanta, Georgia. Today I'm a full-time author. On Sunday, June 20th of this year, I had a heart attack. Thanks be to God I survived and I'm doing well. However, I'm here today because of my experience at Mission Hospital. It revealed to me problems that, in my view, go beyond any one shift or individual. There were breakdowns in communication, coordination, and basic logistics that could have cost me my life. I share my personal experience not to attack caregivers. Most were fine, kind, hardworking people, but I'm here today to call for a system that fixes what our community deserves: broken processes. On the morning of June 20th, I called 911 around 11:30 a.m. because I was having chest pains. When I got to the emergency room, my blood work, my troponin level was 0.234, indicating that I was having a heart attack. But the medical staff ignored it. It was not until 6 hours later that I finally saw a cardiologist, after telling a new nurse that if this isn't a heart attack, then we have to figure out what else is going on because the pain had become intolerable. I was told I was having a panic attack, which I've never had, and heartburn. They also diagnosed me with diabetes. It was only then that I got an echocardiogram. My troponin level rose to 1,000% by the time I was taken into the cath lab. The main artery to my heart was blocked. The damage my heart went through because I did not receive proper care upon arrival at the hospital earlier was avoidable. Before the procedure to open the artery, I was prepped on the cardiac floor, but in the cath lab, I had to be re-prepped. The nurses in the cath lab said that the floor nurses refused to learn the correct procedure. Again, I'm having a heart attack at this point and a lot of pain, and the hospital staff are wasting time because they don't have their procedures ironed out. I spent that night and much of the next day with a Swan, a neck catheter where I could not turn my head and had to lie still. Several nurses indicated this device should never have been inserted because my heart flow was excellent, but no one with authority was available to issue orders to remove it. I was told the nurses were afraid of the cardiologist on call, and I spent the night and most of the next day with back and neck having painful spasms, unable to turn over or to turn my neck. The Swan was never hooked up to anything to be readable. It was just in my neck. How dare the hospital leave a person who has just had a heart attack and horrible avoidable pain? My nurses apologized repeatedly with tears, saying that she was tired of working in a place where she couldn't give patients proper medical care. The second night I spent in the ICU, I had no sheets on my bed, with staff citing that there was laundry and supply delays of all kinds. I lay in a naked mattress with only one blanket to cover me. The nurse said that the supply closet was going to be restocked the next day, but that didn't mean they would get the supplies that they needed. Nurses freely talked about what a horrible shape the hospital was in. Likewise, in the step-down unit, basic equipment was unavailable. There were no thermometers for most of one day to take my temperature. I had a heart monitor that didn't work and was eventually replaced with a hardwired backup that limited my mobility even after I was cleared to get out of bed. Medication was duplicated. The ICU put in orders for medicines, and so did the step-down floor. Within a 15-minute period, 2 separate nurses came to give me duplicate medicines. If I had not been alert and refused to take them, they might have killed me. And they told me, "Don't worry, this happens all the time." Food was inconsistent with a diabetic cardiac diet. I went nearly 24 hours without a proper meal, relying on nurse-scrounged snacks. Meals ordered for me went to the wrong room and they threw them out. Later, trays included items like brownies and milk and pizza. For a newly diagnosed diabetic and cardiac patient, that felt out of step with widely accepted nutrition guidance. Upon discharge, I found the medication they sent me home with was incorrect. After hours on the phone, I had to return to the hospital to get the correct medications. I was told that a computer issue was at fault. On discharge, no guidance to administer insulin or testing my blood glucose was given. 3 different people showed up in my room before I checked out, but none of them had a kit to show me how to do glucose monitoring or give myself insulin. The only discussion on diet was a picture of a plate handed to me in the elevator as I left. I learned how to check my blood glucose and give myself insulin from YouTube videos. The 1-page discharge sheet told me to inject 30 units of insulin a day, which I did the first day home, and it caused a dangerous low. Continuing to take the prescribed 30 units a day could have killed me. I hired a coach from an international medical group that not only teaches diabetics to become insulin sensitive again, but helps heart patients reverse heart disease. It felt smarter to do this than to take advantage of Mission's heart failure clinic. Failure didn't seem like a good option to me, and it seems to define the situation there. Well, on August 1st, 6 weeks post-heart attack, I was able to stop taking insulin and all diabetic medicines. In fact, when I woke up this morning, my fasting glucose was 82. I was told in the hospital I would be on insulin for the rest of my life. However, I am no longer testing as a diabetic or even a pre-diabetic. This is proper medical care, not what I received at Mission Hospital. These are not all of the problems I experienced, but my point is simple. I encountered mostly good people in a strained system. I experienced a lack of authority, supply gaps, conflicting orders, confusion over medications, and inconsistent communication. Also, it cannot go without saying that in a strained system, there is no way to hold incompetent nurses and doctors accountable. It only takes one to destroy your health. Asheville, a city I truly love, deserves better than this. Thank you.
Thank you very much. I'm very sorry for that experience. I say that a lot in response to emails that I get from folks. I'd like to now invite up Representative Brian Turner, who also has some words to offer.
And thank you, Senator Mayfield, and I want to thank everyone who's here today in support of this effort. My name is Brian Turner, and I represent the State House District 116, which includes the City of Asheville, Woodfin, Biltmore Forest, and Mission Hospital. I very much appreciate the Reverend Stories and her treatment at Mission. To be clear, I am not a nurse. I am not a physician. I am not a healthcare expert. I'm a businessman. And so that is my perspective on HCA's performance. It comes from my experience working for Fortune 500 companies, in financial consulting, small family businesses, and just about everything else in between. So what does it mean to run a successful organization, a successful company? Of course, how you define success matters. If you talk to my old econ profs or the folks in my MBA, Wall Street, HCA headquarters in Nashville, they'd tell you that a successful business is one that increases shareholder value. And if you are in the business of making widgets, perhaps maximizing shareholder value is a good and true measure of success. But HCA isn't in the widget business. They are in the business of healing and saving lives. Patients should not be cost of goods sold. No one's chance to beat a disease is part of the gross margin. And healing from an accident should not show up on the P&L. This is the difference between the nonprofit health system we used to have and lost, and the for-profit health system we now have and must endure. By Wall Street measures, HCA is a very, very successful business. When HCA bought Mission in February of 2019, the share price was $140. 6 years later, that share price is now $400. That's a 185% increase. The S&P return over that same period, 165%. HCA has outperformed the market by 10%. Great for shareholders. not great for Western North Carolina. Those kinds of returns and profits don't happen by accident. It doesn't come by delivering better health outcomes. It doesn't come by making sure the floors are staffed with enough nurses. And it sure doesn't come by welcoming other health systems and healthy competition into our region. Competition that would lower prices, drive innovation, and provide patient choices and options. Outperforming the S&P takes focused effort. A business typically has two levers to accomplish this: cut costs and increase revenues. HCA's gains come from cutting costs by understaffing nurses, eliminating less profitable care, typically in rural areas, and reducing non-clinical staffing to a skeleton crew. Increasing revenues, they turn beds as quickly as possible, and they work endlessly and tirelessly to build private insurance, driving up premiums and costs for everything and for everyone, and hounding those who are struggling with medical debt. The folks who walk into an HCA hospital, clinic, or urgent care are our friends, our neighbors, our families, and many times ourselves. We are not widgets. We are not lines in a financial statement. We are not revenue streams and profit centers to be maximized. And we are not okay, with what is essentially a monopolistic behavior by the largest healthcare provider in Western North Carolina and the largest healthcare provider in the United States. So I say enough is enough. It's time for HCA to decide if they want to be a healthcare provider who genuinely cares about the health of its patients, its staff, and will invest in the well-being of the community, or if they want to extract the maximum profit possible from a region that has few choices only to satisfy investors who are demanding greater and greater returns regardless of the consequences. If it's the former, I'm excited, and I think everyone else in this room would be too, to help and work with them. If it's the latter, I would ask them to find a buyer, sell our once beloved mission to an organization whose bottom line would include improving the lives and health outcomes of the community they serve. Thank you.
Thank you, Representative Turner. I think a lot of us share those exact same sentiments. I'd like now to invite to the podium Dr. Mike Messino.
Thank you, Senator Mayfield. Good afternoon. My name is Michael Messino. I've been part of the Asheville, Western North Carolina community since 1990. I started a medical oncology program that eventually included 14 physicians, 20 advanced practitioners, certified chemotherapy nurses, multiple support staff. I left an academic position to begin a practice in a community and a hospital that had a very good and growing reputation. In 2010, our group was the first group to enter into a professional services agreement with Mission Hospital. Sadly, at the end of 2019, we were the first group to leave any service agreement with Mission Hospital. I'd like to think that all the time that I've spent here and all the growth we have had has been a good and quality situation for the patients of Western North Carolina. Then the sale came in Mission in 2019, and there were very big changes. The budget for housekeeping with Mission Hospital decreased by 50% the first year. That's why we had so much problems with housekeeping issues. Nurses and other staff began to be cut or began to leave. Programs were cut because of loss of staff or because of dissatisfaction of physicians or critical staff losing trust in the new Mission system. More than 250 physicians have left, and an unknown number of nurses have left Mission Hospital. Ancillary staff, including CNAs, ward clerks, transporters, laboratory personnel, physical therapists, discharge planners, social workers, chaplains, morgue staff, and sterile processors have either been terminated or left. These are people that are important for running a hospital. Units that for years were stable with staff that had been there for many, many years began to struggle to keep enough staff to have a functioning unit. No longer did you see the people that made their career at Mission Hospital working on the floor. These were people that you knew from Western North Carolina. These were people you trusted. You could feel the change in the attitude of the staff in the hospital very quickly. So what is the result of all this? A decline in patient care and satisfaction. There are a lot of superb physicians that remain at Mission, but physicians will tell you that not necessarily do patients need them. They come to see the physician because of the expertise, but they stay in their practice or they stay in their hospital because of the good care they get from the support staff, particularly the nurses. It's an overall experience that is very important. Patients rely on discharge planners, social workers, physical therapists, chaplains, and those behind the scenes like the laboratory workers, the pharmacists, and the support that they give to the nursing staff to give you good care. Let me be clear that there are very good staff, especially nurses, who have continued to struggle every day to give the kind of care they're used to giving. But they can't when they're placed in a situation where they are asked to care for more sick patients than they can and asked to care for more patients than they have ever had to care for. They risk their license and their personal well-being every day when they try to take care of us. Nurse ratios have been out of control since HCA has taken over Mission Hospital, and that is how you end up on an immediate jeopardy finding like was found last year, and tele violations that we've seen the last 2 years. Nursing care is something HCA does not quite understand. A nurse is not a nurse is not a nurse. You cannot be an obstetric nurse and be asked to go to the emergency room and try to take care of a patient that you're not accustomed to seeing. You cannot treat nurses like a commodity, and that's how they have been treated over the years. What happens when you do not have a stable nursing staff? You have declining quality of patient care and complications and even death. This is most clearly reflected in the HCAP scores. The HCAP scores is a survey that is national, standardized, publicly reported survey of patient perspectives of hospital care. The 32-item instrument and data collected methodology allow valid comparisons to be made across hospitals. In 2016, Mission scored 4.1 out of 5. 2017, 3.8, both respectable scores. Consistently high scores were the norm. However, they have declined steadily since 2019, and the cumulative score for 2023 and 2024 was 1.5. This is less than half what our scores were in the past. Nothing shows the decline at Mission better than the transparent and independent methodology that you see in HCAP scores. There are a number of different organizations, some of which Mission attempts to use. A lot of those scores have been brought to question by the news agencies and by the people who work in the hospital themselves. Recently, there's been an issue with telemetry, which is the monitoring of data such as oxygen levels and heart rhythms of critically ill patients. Telemetry used to be located in the hospital on the floor where the patient was located. The equipment and the technicians are now located off-site. This is to, quote, make things more efficient. However, They then are asked to be responsible for more patients, and these patients that they're being asked to be more responsible for are more critically ill. Often it's the early detection by these people that results potentially saving a life. But if the system breaks down, as has happened recently, then people can die. As a physician, I look at a number of parameters. I look at the history of the patient, I look at the patient's symptoms, and then I look at all the diagnostics. Then I come up with a plan of treatment. It's now been 6 years of symptoms and ongoing results to determine that Mission Hospital is a gravely ill institution. My diagnosis is that Mission Hospital requires a significant and urgent staffing increase with a focus on much improved nursing ratios. Our community needs management at HCA to start the recovery plans immediately. Then there may be hope to try to reverse this. But I'm skeptical. I'm very skeptical, having been here from the beginning of this situation. As mentioned earlier, HCA is committed to trying to hire 200 people in 100 days. 100 of those people are supposed to be nurses. And we would applaud HCA if they would do this. But I have my skepticism because of the reputation of the institution at this time, the reputation of HCA itself. Regardless of how many new hires HCA makes, we know nurses and staff will continue to leave. So we need more than just a short-term hiring commitment. Reclaim is asking for transparency and accountability from HCA to the public, specifically to for the following information on an ongoing basis. 1, what are the nursing ratios or staffing grids in the emergency room and on the floors? In other words, how many nurses do you have per patient trying to care for critically ill patients? Number 2, how often does Mission meet these staffing ratios? We've had lots of comments made that the staffing ratios are made and they can't keep them. Number 3, are they meeting them with travelers or are they with permanent nurses? And do these nurses have the requisite experience to work in the unit that they're being asked to work for? And finally, what is the plan to try to retain these people? Retention is a very big part of healthcare. I can remember one of our units having nurses that had been on that unit for years. Our unit was stable. We didn't lose anybody for 2 years. That doesn't happen anymore. We encourage hospitals in our region to share their information as well, because we do not hear the same kind of complaints coming from hospitals in this region that we hear in regards to Mission Health. Thank you.
Thanks to everyone. As Dr. Messino laid out, our hospital is gravely ill. And as Representative Turner said, a responsible healthcare company would care more about its customers and its staff than it would about its profits. In both instances, the answer is staffing. Reclaim's vision is that Western North Carolina residents will be able to once again trust that they will receive quality care at Mission Hospital. We want a hospital where nurses, physicians, and support staff can show up with confidence that there will be enough staff to safely care for the patients there. We want a hospital where community members can show up with confidence about the care they will receive, and where they will reward that hospital with high post-satisfaction scores rather than what we see today. To restore public trust, HCA must be transparent and accountable to the public regarding its commitments to increase staff and improve care. We call on HCA to heed this call for more transparency and accountability, and to show our extended community that they are serious about making change. I'll stop there and happy to take any questions from anyone.
You said you're concerned about the public not knowing about incidents sort of after they've passed along. Is there any either conversation or policy that can be employed at NCDHHS to change it so that the community is aware of those incidents when they happen, or is that a matter of legislation?
Yeah, that's a great question. So again, the question is the policy that DHHS has about saying that there are no deficiencies if, in fact, there were deficiencies that had been addressed before the regulators arrived. We actually understand that this might happen differently in different parts of the country. So our understanding from DHHS is that this is CMS policy. But as we know, the country is divided into different federal regions. And DHHS has committed to us that they will check again with CMS about the instructions that they have gotten and the protocols that they are using on that particular point. Because our understanding, again, is that it is not, in other parts of the country, even though the agency might issue a finding of no deficiencies, they will also acknowledge that claims were substantiated and that deficiencies were found but have been addressed. And that makes a world of difference. Other questions? All right. Again, I want to thank everybody who's here today and thank our speakers and appreciate the support for our ongoing efforts as a community to improve conditions at Mission Hospital and to help, I think, as Representative Turner said, help HCA recognize that this community actually would stand with it if it made some different decisions about bringing the community in to help it solve some of these persistent problems. Thank you. All right. Thank you, everybody. Really appreciate it.
I'm very